Currently, there is relatively little research on the effects of nutritional supplements on spine health and specifically on osteoarthritis of the spine. At this point in time, existing studies of glucosamine and chondroitin sulfate are inconclusive as to whether or not the dietary supplements can prevent or reverse the joint cartilage degeneration associated with osteoarthritis. Some studies show that certain patients with mild to moderate osteoarthritis who take the supplements may have pain relief at a similar level to patients who take non-steroidal anti-inflammatory drugs, or NSAIDs. One study on knee and hip osteoarthritis showed a moderate benefit of taking glucosamine and chondroitin sulfate supplements. The studies mentioned above generally showed that if no pain relief occurred after taking glucosamine and chondroitin sulfate for 2 months, there was little chance of improvement if the patient took the supplements for a longer duration. However, a standard duration of treatment and expected course of improvement for glucosamine and chondroitin sulfate have not yet been determined. It is important to note that nutritional supplements such as glucosamine and chondroitin sulfate are not subject to the same strict regulations by the U.S. Food and Drug Administration, or FDA, as are medications, such as NSAIDs or narcotic pain medications. During a meeting held in January 1998, a group consisting of National Institutes of Health, or NIH, and FDA staff as well as experts in osteoarthritis, alternative medicine, and other specialties identified the need for more in-depth testing of the safety, efficacy, and side effects of glucosamine and chondroitin sulfate for osteoarthritis. As a result of the 1988 meeting, the National Center for Complementary and Alternative Medicine, or NCCAM, and the National Institute of Arthritis and Musculoskeletal and Skin Diseases, or NIAMS, have begun a study called the Glucosamine Chondroitin Arthritis Intervention Trial. The study is the first multi-center trial in the United States to test glucosamine and chondroitin sulfate for reducing pain and improving function for patients with knee osteoarthritis. The study randomly assigned patients to groups to test either the effects of taking glucosamine alone, chondroitin alone, glucosamine and chondroitin sulfate in combination, Celebrex, or celecoxib, a popular COX-2 inhibitor, or a placebo. Glucosamine chondroitin arthritis intervention trial also tested whether glucosamine and chondroitin sulfate nutritional supplements can help slow or stop the progression of knee osteoarthritis. In May 2004, enrollment for the glucosamine chondroitin arthritis intervention trial study was completed and data were being analyzed. Participants taking the positive control, celecoxib, experienced statistically significant pain relief versus placebo. About 70% of those taking celecoxib had a 20% or greater reduction in pain versus about 60% for placebo. Overall, there were no significant differences between the other treatments tested and placebo. For a subset of participants with moderate to severe pain, glucosamine combined with chondroitin sulfate provided statistically significant pain relief compared with placebo. About 79% had a 20% or greater reduction in pain versus about 54% for placebo. According to the researchers, because of the small size of this subgroup, these findings should be considered preliminary and need to be confirmed in further studies. For participants in the mild pain subset, glucosamine and chondroitin sulfate together or alone did not provide statistically significant pain relief. While more scientific research is needed on the effects and safety of glucosamine and chondroitin nutritional supplements, many physicians consider them a viable osteoarthritis treatment for the following reasons. There is some available evidence supporting the benefits of glucosamine and chondroitin sulfate. More research is currently underway with glucosamine chondroitin arthritis intervention trial, the study run by the NIH and FDA. There is currently a lack of more effective traditional medical treatments for osteoarthritis pain. Glucosamine and chondroitin sulfate nutritional supplements have a low incidence of serious side effects. For maximum pain relief, glucosamine and chondroitin sulfate can be used in combination with other non-surgical treatments for osteoarthritis and, as appropriate, with lifestyle modifications, such as rest, gentle exercise or weight loss. Patients should always work with a physician to ensure safe use of all nutritional supplements.